Brittany Bullard with Comprehensive Primary Care and Wellness Center. Here's our team. So I'm a doctor of chiropractic and I specialize in functional range conditioning and movement analysis. So I integrate movement into every patient that I treat because motion is lotion, and we know when we move around we feel better. So it's not just adjustments in the traditional sense that most chiropractors are used to doing, but we use a lot of exercise, we use a lot of tissue therapy, and then we also utilize referrals to other areas. So if we can't get you there right away with just movement, we have other options that we can do with diet analysis or with pain management or with injections. So we're very integrated in our approach, and that's how I fit in.
So my name is Scott Ulrich. I'm one of the PAs over here at Comprehensive Primary Care. I've been here in town for the last 10 years. I've spent the last 5 in family practice, and prior to that I was in women's health. And here at Comprehensive Primary Care I work with individuals on all primary care options, from general health concerns, annual wellness exams, treating diabetes, blood pressures, other chronic conditions, any kind of acute conditions or anything like that. That's what we treat. That's what we do over here, and it's been a terrific opportunity for me, and there's some great exposure here.
I'm Monica Nealis. I've been a physician assistant here in the Idaho Falls area for the last 22 years. My main focus has been women's health care, now doing primary care also. I have a great team here. The integration has been awesome. It's nice that we don't have to send our patients out for any kind of referrals. We have Dr. Marty Mangan, Scott, Dr. Bullard, and Christina, who each one of us brings our own specifics to the practice, but in the end we can treat the whole patient, which is really nice. We work with each other very, very well, and getting the patients back to health is our #1 priority.
All right, I'm Dr. Mangan. I'm a family physician, also specialized in emergency medicine and occupational medicine, and I've been practicing in eastern Idaho for 10 years now. I'm excited about the team that we have gathered together with all different levels of expertise, and I think that we complement each other because medicine is not the same. It comes in many different forms, many different hats, and I think that we do a evidence-based approach, also a wellness approach, as well as an alternative approach.
I'm Christina Finnerty, family nurse practitioner. I have been in Idaho Falls for a very long time. I have worked in the medical community for the last 17 years here in Idaho Falls. So my background involves family medicine, women's health care, sleep medicine, and integrated medicine. I really enjoy taking care of the whole person, and I love our team here. We are all hand-picked and special. We came together to create this practice to be different and to be able to look at the whole person and really have the time to listen and take an individualized approach to healthcare. We have such a unique team, and there's nothing that we can't figure out amongst ourselves, and if there is, then we have a great community to refer out to. We really want to be able to help people feel welcome when they come into the practice, see smiles, and have a happy place to come where you feel like you're part of a family and not just a number. So I really enjoy that we've come together as this very dynamic group with a lot of medical background and a lot of different expertise, and just the fact that we have fun and we really enjoy each other's company. I think that makes a big difference within a practice, and we'd love to have you come in.
Beautiful.
What stood out for me is how you and Ashley came at 7:30 in the morning, and you went out and you went and got a special gift for this person, and you were there by her side. If you can just elaborate that to give her the news.
So my history comes with I've undergone breast cancer myself, and having cancer, being the patient is very hard. It's harder, unfortunately, when I think you're the provider and you then become the patient. One of the things one of my patients did for me when I was going through breast cancer is she let me know she was there. It meant more to me than anything, just because it was more than family, it was more than friends. It was somebody I wouldn't even have would have thought twice of me when I was going through my treatments, whatnot. and she just showed up and said, I'm thinking about you. So that lady has been amazing to me and changed my life. And so now when I diagnose a patient with cancer, I do something special for them. My nurse and I, whichever nurse it is that has helped me diagnose the patient, we go beyond what we need to do. We come in on our off time, we spend extra hours in calling different doctors' offices, getting them the referrals they need, getting them the treatments, the follow-ups, and I try to be to each one of them's first day of cancer treatment, radiation, their surgical procedures, and show up with something nice that lets them know they're not just a number, they're not a chart. They actually have a friendship in us, and that they're more than welcome to follow up with us at any time they need, even if it's just a shoulder to cry on, because cancer's never anything to go through alone. I've learned it myself, and my patients, they mean everything to me, and I want to make sure they understand they're not just a patient, they're my now family.
We have wellness in the name, and so it's not just a specific wellness program that we're attempting to package and sell. Every one of us is geared towards wellness. So we not only want to return people to health, but we want to help them maintain it. So as a chiropractor, one of the things that I'm focused on is helping people be independent so that they know how to manage themselves and stay healthy. I'm not trying to see people a whole lot as a chiropractor, and that's kind of unusual for many practices. And what's awesome is that we all have that in the back of our minds. So when you see Christina, or you see Scott, or Marty, or Monica, we not only want to get you back to to health, but we want to bring you into a state of wellness. So we teach you more things that you can do for yourself, and it's all done on an individual basis and with collaboration. So we discuss kind of what you've told us, and we're able to formulate, hey, you know what, this is the next best step for you. And that's awesome, because not only then can you take steps that make sense for you, but when you see me and then you're referred out and you see Marty, he's going to follow up on that. So you also get a little accountability, which really, really helps people drive change in their lives.